This video will give you a brief overview of the steps completed at the end of the case. The first item is the Safety Checklist Sign-Out. This is where you will document if you have verified what procedures were performed during the case, if the surgical counts were correct, identify any specimens obtained during the procedure, if any equipment problems need to be addressed, and if there are any concerns regarding the management of the patient. Selecting Next will move you back to the Surgical Procedure segment. Let's move back to the Case Time segment where you will document the procedure stop time. You can then take your patient to the PACU to give a verbal report. Upon returning to the OR or procedure room, you will need to chart your patient out-of-room time in the Case Time segment. You will also need to chart the out-of-room times for each case attendee. By clicking on the physician name and then choosing Modify, the out-of-room time will pull forward and will auto-populate the times for the rest of the attendees. Selecting Next will move you back to the Surgical Procedure segment. This allows you to double-check the procedures performed and make any final modifications if needed. Selecting Next will move you back to the General Case Data segment where documentation of the postoperative diagnosis is to be performed. The last segment we will review is the Transport segment. Document the patient status, if any equipment was used during transport, where the patient was taken to, and the method used for transport. Lastly, verification that a report was given to the next caregiver is to be documented. Selecting Next will save your case documentation. Navigate back to the pick list and verify the items used are accurate and all charges are there. To return any unused items, right-click on the case list title and select the Return Unused option. Save your changes by clicking on the disk icon. You are now ready to sign your note. To sign your note, simply select the Documentation tab and then choose the green flag icon. A verification window will appear requesting you to confirm that the document is to be finalized. You can close the patient's record by selecting the X on the Chart tab. To exit PowerChart, select the exit door icon from your toolbar options. This concludes the video for the charting process for the intraoperative nurse.